You're listening to a podcast from the BMA.
The BMA's Humanitarian Fund offers NHS clinicians the opportunity to share their knowledge, skills and good practice to benefit communities in the developing world. I'm Flavia Mudd and I spoke to Jonathan Fitzsimon, a GP trainee from Bristol who was supported by the fund to work on a project in Bolivia. I began by asking him what was the aim of his project.
Well, it actually started about 5 years ago when I went out as a medical student to Bolivia and worked with a GP there, part of my elective. And then it was just a process that I kept going back just for short periods of time, a couple of weeks. And then I decided to actually go out for a year to work as a volunteer doctor. And that was in 2009. And during that time, I set up a diabetes clinic, which is run by Bolivian nurses and Bolivian doctors, but it receives funds from the charity that I set up basically to provide funds for my work. And so what I wanted to do in 2011 was to go back out to Bolivia and really just provide a bit more training for the nurses to help the development of the centre, to make sure that we're providing the very best treatment, and just to see what further help I would be able to give the team there to develop the care that we were giving to the patient.
In terms of developing the care given to diabetic patients, what kind of practical changes did you introduce and what sort of improvements did you see?
When I first started, so in 2009, I literally started off with a group of 20 patients, and we did some quite intensive work with them in that they had a consultation with me once a month for 4 months. And obviously we took lots of sort of clinical measurements. And then I was able to go back and look at these patients who've now had nearly 18 months of treatment in the centre. And when I say treatment, it really is in the sort of quite a loose sense, in that they drop into the centre, they check their own blood pressure, they check their own weight, they have 6 monthly blood tests, and they get advice about whether they need medications, whether they need to change their dose. So it really is that contact and that advice and the education side of things which has been our key change. And when I looked at their results and compared their scores to when I first started with them 18 months ago, I mean, that there were absolutely huge differences. The average weight loss in those 20 patients was 3.5 kilograms, and the average decrease in HbA1c levels was coming down by almost 2.5 percentage points. You can see with really simple measures that we were making a huge difference to their control of their diabetes.
It sounds like you were able to make a real difference to improve the management of diabetes, but were there any obstacles you had to overcome?
Yeah, we had. I think sort of the biggest cultural obstacle that I faced was the difference in the relationship between nurses and doctors in many South American countries actually, but particularly in Bolivia. Many people, many patients see the doctor's word and the doctor's treatment as being more valuable than seeing a nurse. And so it was quite a cultural shift both for the staff and for the patients for me to try and emphasise the importance of every opportunity of any of the healthcare professionals, whether it was the nurse or the doctor, to emphasise the importance of diet and blood pressure and activity and those sort of things. And to get across that idea that it's just as important coming from a nurse as it is from a doctor, that was quite a difficulty, and I think we're still working on that really. I wouldn't say I've sort of completely got over that barrier yet.
Was raising the money or getting time off to go to Bolivia an issue?
So when I went back in November, I actually went for 3 weeks, and I was able to take some leave from my post as a GP trainee, but that was unpaid leave. But on top of that, if I'd have had to also pay for my travel costs and some of the administration costs that I had whilst I was out there, as well as being unpaid for a month, then I think that probably would have been too much. I wouldn't have been able to do that. So whilst I was prepared to sort of take some of the hit in terms of my own unpaid leave, actually having funding for my travel costs and my living costs whilst I was out there really made it possible, to be honest. And I know from the feedback that I've had from the team out in Bolivia that me being able to go out there and talk to the team again really sort of enthused them and gave them a boost, and hopefully will help them continue their great work over the coming year. So I think, not to put too fine a point on it, without the grant from the BMA, I wouldn't have been able to go this year. And so that enthusiasm and that regeneration of passion in the team in Bolivia wouldn't have been possible. So it really did make it happen, to be honest.
It seems clear that the work you have done has filled you with a great sense of enthusiasm, but do you feel that your experiences have made you a better doctor?
One thing I think it's really helped with is my communication skills. In Bolivia, or certainly the part of Bolivia that I was working in, nobody speaks English, and so part of the process for me has been to learn Spanish, and I find it difficult, and I find you have to concentrate hard when obviously having a consultation in a different language. But I find that that's really helped me, because it means that I tend not to talk too much. I don't sort of use too many flowery words because I don't know them in Spanish. And when I sort of realised that was really helping me relate to the patients, and they really appreciated the fact that, you know, I was concentrating hard on what they were saying, that it's almost been an eye-opener for me as just how important that is in a doctor's relationship with the patient. And when I've come back to the UK and back consulting again in English now, I do find myself trying to take some of those lessons forward and really listen very carefully to what the patient's saying to me, and try to be more succinct in when I'm giving explanations about any sort of medical education or lifestyle changes in particular.